Hello, everyone. Very good afternoon if you are joining us from US, and a very good evening if you are joining us in South Asia. My name is Adnan Rafiq, and I am the country director for United States Institute of Peace in Pakistan. Welcome to our webinar on the coronavirus crisis in Pakistan, a provincial perspective. USIP is a national, nonpartisan, and independent institution founded by US Congress and dedicated to work towards a world without violent conflict. The institute strives to prevent, mitigate, and resolve violent conflict around the world through its research and analysis, programs, and convening events such as these. In Pakistan, USIP has maintained a field office since 2013 and works with a range of stakeholders within civil society and the government institutions to reduce violent conflict and develop greater social cohesion and peace. So, as we know, COVID-19 is a major ongoing crisis, not just in Pakistan, but globally as well. So we're looking at different countries and different contexts in terms of the response and the developing situation. And a couple of weeks ago, we organized another webinar as well to look at more sort of at the national level, how COVID-19 is being responded to in Pakistan. And you can find its recording at the USIP's YouTube channel. And today we'll be looking at more the subnational perspective, because since 18th Amendment in 2010, health, education, policing, all of these are provincial subjects. So the provinces are at the forefront of responding to COVID-19. So we have today with us eminent panelists from all parts of Pakistan to provide us an overview of the on-ground situation in different parts of the country. And then we'll go on to discuss various emerging themes from this analysis. Please feel free to join in the discussion through the comments section on our YouTube channel. You can type in your questions throughout the proceedings, and towards the end of the webinar, we'll be bringing in your questions, and we'll be putting these to our panelists. So I would introduce our distinguished panel for today. We have with us Nosheen Anwar. She's professor at IBA based in Karachi, and she also leads Karachi Urban Lab. We have with us Umair Javed, who is assistant professor at LUMS University in Lahore. Fasi Zaka hails from Khyber Pakhtunkhwa province. He is an independent analyst and public policy expert. He is also a noted columnist and anchor person. And we have from Quetta, Balochistan, Rafiullah Kakar. He is also an independent public policy analyst and is also advising government of Balochistan on strategic planning and reforms. So without much ado, I'll start with Rafiullah Kakar from Quetta, who himself contracted coronavirus and is recovering from COVID-19. So Rafi, please inform us about your health. How are you feeling now, and your analysis of the situation in Balochistan, please.
Thank you, Adnan and USIP, for organizing this, what is likely to be a very useful panel discussion. And thank you for the personal inquiry. I'm recovering well, and I'm almost done with it. Luckily for me, I didn't show any sort of major symptoms. The symptoms are only mild, but I'm recovering. So thank you for that. And coming to your question about coronavirus and the response of the provincial governments, I would sort of just quickly talk about the steps or the measures taken by the government of Balochistan, and sort of the quick overall the impact of this crisis on economy and life in Balochistan. There are two very distinguishing features of the economy in Balochistan, or the life in Balochistan. The share of informal economy in Balochistan is very huge. A significantly large share of the economy is informal and undocumented. And secondly, most of the economy is dependent, particularly the services sector, is dependent on border trade. So it is dependent on the borders remaining open. Uh, when we were trying to estimate the impact of the COVID-19 on Balochistan and the economy and its people, uh, we were investigating and analyzing multiple pathways, but primarily we realized that the services sector and the urban economy were the biggest hits. And within the services sector, again in Balochistan, it's primarily the wholesale and retail sector and transportation sectors, subsectors. These were severely affected, and since they are so closely tied with the border trade and the borders with Afghanistan and Iran, both those borders are closed for both movement of goods and movement of people, except for occasional and temporary relaxations. So the services sector has particularly been hit severely, and we have estimated that the expected GDP forecast for Balochistan before the corona crisis was around 2%, and now it is likely to fall somewhere between -2% and -6% in terms of the amount, that that will be lost. It will be somewhere between 60 billion to 90 billion rupees, and this is just a ballpark figure of the losses that the economy is likely to sustain during the crisis. But the impact on the informal economy, on the bazaars, and on the wholesale sector, that is even bigger. The number of people falling into poverty has increased significantly. So this is a quick sort of overview of the impact of the crisis on Balochistan. The government has taken a number of measures similar to measures taken by other provinces, from restrictions on movement of people to restriction on movement of goods, closure of markets and commercial centers, closure of borders, ban on intercity transport, etc. But unfortunately, for a variety of reasons, the implementation of these measures has not been at its best, and the cooperation of citizens and their understanding of this crisis is also something that needs serious attention. And in addition to this, other sort of immediate health related interventions have also been announced. Relief packages have been announced. I don't know if we can go into the detail of those, but I'll just stop with this quick summary, and then if you had any sort of follow-up question, I'll leave that to you.
So thanks, Rafi, for this. We'll go around to every panelist to get an overview for each province, and then we can discuss some of the emerging themes. So next we go to Nosheen, because Sindh has taken an early position at the onset of this outbreak. And so Nosheen, if you can please take us through the response and the situation in Sindh. Sorry, I think you are on mute.
Yes, there we go. There we go. So thank you, Adnan, and it's a privilege to be a part of this conversation. So Sindh went into lockdown quite early, even though that was a point in time in mid-March when federal government still appeared to be muddling over a decision on whether or not the lockdown should be countrywide. And I think Sindh's decision to go into lockdown was largely triggered by the discovery of patients who had been infected by the virus, specifically those who had come in from Iran via Taftan after performing pilgrimage. And it was shortly thereafter, after this discovery, that the chief minister, I think triggered by this particular issue, decided to take these steps. And the lockdown has been much like Balochistan, all over. And the government has been taking certain steps that Sindh government has been taking certain steps that should be applauded. For instance, it set up the coronavirus emergency care and cure center, with isolation wards. This was established at the labor colony flats in Sakhar. The establishment of help desks at Jinnah International Airport in Karachi for screening passengers. And then also establishing in mid-April, the first drive-through COVID-19 testing facility in Karachi. And Sindh also appears to be the most affected in terms of the virus. I think the numbers are now approximately around 13,000 cases to date. This is just slightly ahead of Punjab. And the reasons behind this, I mean, we could discuss them later if they are of value, that perhaps Sindh is performing more tests, but I'm not entirely certain. But there are certain caveats to all of this, of course. All of these actions on the part of the Sindh government have also been happening in the context of much criticism that is pouring in from opposition parties, specifically, for instance, that the chief minister has made these decisions about the lockdown without taking adequate measures, for instance, taking into consideration or coordinating with the institutions of parties like the Jamaat-e-Islami. And there are allegations of insufficient or inefficient distribution as far as welfare relief measures are concerned. So these tensions between the Sindh government, political parties at the center in terms of how emergency policies should be handled are ongoing. But there are these tensions also scaled down quite a bit, right? So I know we're going to be coming to a point where we might be discussing the whole provincial government, federal government, center province dynamic. But I just want to sort of flag a very important dimension to this, that these tensions also scale down to the local government district levels in terms of the role of union councillors and so forth. And some of the sources of tension that have emerged recently are about the COVID-19 Emergency Relief Ordinance 2020. And this contains many provisos about offering concessions to the poor. For instance, a 20% reduction in school fees, decrease in house rents, that it should be made mandatory for the private sector to not lay off employees, concessions, especially for the payment of electricity and gas bills. However, the Sindh governor, who is a PTI representative, has declared that these kinds of provisos and these kinds of concessions, especially those concerning for payments of electricity and gas bills, that the provincial government does not have the decision-making capacity or the authority to offer these kinds of concessions to the poor, and that these kinds of decisions come under the domain of the federal government. So this particular ordinance has become, of late, in the last 10 days or so, a particular point of contention, vis-a-vis how policies concerning the handling of the coronavirus and relief measures should be handled. So I'll stop right there, and perhaps we can come back to these issues later on as we approach more.
Thank you so much. Thank you so much, Nosheen. And Umair, how does it look like in Punjab?
Thank you, Adnan. It's somewhat similar to what we've been hearing so far. I think Punjab has, even though it wasn't one of the early decision makers as far as imposing the lockdown was concerned or restricting particular types of activities was concerned, they eventually, somewhat belatedly, sort of imposed various kinds of restrictions on economic activity. I think those have largely been done in coordination with the federal government, because there is obviously the same party in power at both the center and in Punjab. So there is, I think, greater degree of cohesion in terms of, or coherence, if not cohesion, in terms of some of the decision making that is being done. I think a couple of other things that are worthy of sort of flagging here is that Punjab is also from quite early on has maintained the position that the virus cannot be curtailed through the imposition of lockdowns, or that lockdowns will pose other dilemmas that pose public policy concerns for the Punjab government, in particular dilemmas posed to livelihoods and social protection. And for that purpose, they've mobilized outside resources to come up with various strategies on how they can counter this, and they've called in obviously, and they've been working in coordination with a number of think tanks, including the Center for Economic Research in Pakistan, SERP, which is based in Lahore. They've been able to bring in expertise from academics based in foreign universities, mostly in the US. Asim Ijaz Khwaja, who's a professor of development at Harvard, has been advising the Punjab government. There have been others. Saad Umar, who's a public health specialist at Yale, he's been working with them as well, and they've come up with a plan. Now, the implementation of that plan has left much to be desired. I think there are significant concerns about the capacity of the government to impose even what they're calling a smart lockdown, which means that they will isolate particular instances within large urban centers and then shut them off for periods till obviously the transmission rate goes down. We haven't seen that happening, to any sort of a great extent. Testing capacity has been ramped up in recent weeks. It's still below what Sindh is currently doing, but Punjab is testing on average about 305 per million, 305 tests per million population on a daily basis. So I think there are certain things that where Punjab has actually, I think, done slightly better, and obviously the case for evaluating those interventions will come later on, is having a very clear-cut idea of what needs to be done as far as the social protection and economic impact of the virus is concerned. So they've developed 2 or 3 strategy documents. They've undertaken certain budgetary decisions, including reallocation of resources from various development agendas that no longer seem as viable. They've obviously, made more money available to the health department for the purchase of personal protective equipment. They've also, in an effort to stimulate economic activity, introduced various tax concessions up to the tune of about 18 billion rupees through cutting back on various kinds of provincial taxes. And they've also developed a strategy what they're calling Rise Punjab, which aims to deal with both not just the immediate fallout of the virus from a social protection and a livelihood perspective, but also in the early recovery and then the long-term economic rebuilding stage. So I think there's a lot of interesting thinking happening around it, but I think the pressing question mark, which I think is something that probably is afflicting all governments at every level in Pakistan, is the question mark of state capacity. Can the state actually deliver on the public health measures that are required to actually curtail the virus? And can the state actually target the particular populations that are greatest in terms of their need, especially given the consequences of the economic restrictions that have been imposed as a result of the virus itself?
Thanks, Umair. Thanks. And Fasi, let's hear from you about the situation in Khyber Pakhtunkhwa.
Sure. Khyber Pakhtunkhwa is about 35 million people, and as of now, the virus incidence, there's been around 5,000 total cases, of which 3,600 are still active. We've had around 300 deaths. In addition, it was one of the provinces that acted fairly early. I think, like Dr. Nausheen said, the Sindh Chief Minister, Murad Ali Shah, he's become recognized as one of the heroes of the crisis so far by taking a lead. I think also in KP, the health minister, Taimur Chakra, has also developed a similar profile. And that's partly because trying to be early and communicating quite actively on the scale of the threat and what needs to be done. The province declared a state of emergency, health emergency from the 3rd of Feb. We had in Pakistan the first cases of coronavirus in the 26th of Feb. The first actual deaths from the coronavirus happened in KP. There were 2. Both people had come back from the Middle East. And early on in the 11th of March, they started closing all educational institutions, banned all public events, including marriages. And then some of the things that Rafi's been talking about, these are also some of the similar economic effects because of this kind of lockdown that was imposed, and it's had a fairly similar effect on KP as well. In terms of health, one of the things that they've been concentrating on is trying to bring together the response that would be it. So they've established, isolation wards across the province for about 2,500 beds. They've done high dependency units. They've got backup facilities in all the districts. They've procured about 1 billion rupees worth of equipment. So that includes PPEs, medications, all the things that were actually short within the existing health structure. And they've also been doing a process of locums, which is temporary contracts to increase the amount of healthcare staff, doctors, to deal with this crisis. So far in KP, there's some evidence that deaths are correlating to the intensity of the lockdown. So now that measures have been significantly reduced, a lot has depended on how people actually cooperate or take measures on their own. So it's fairly open how things will change over the next month or two. I think this is also the situation nationally. So far, in terms of deaths, there's also a very significant gender component. The majority are men, 80%, 20% are women. In terms of the comorbidities of cases, 70% had comorbidities, and the comorbidities were mainly cardiovascular disease and diabetes. Dedicated hospital beds at the moment are at 40% capacity. So there's still room in order to go, but intensive care units are pretty much closing in the gap of what they can provide. And in terms of non-COVID beds, there's still 30, 40% that could potentially be changed in case the situation gets moved drastically. But as of now, the situation is somewhat contained. The government of KP is also supplementing with their own program as part of the ESAS national program, which is helping people at the lowest rungs of the economic ladder deal with the loss of livelihoods and incomes. So anyhow, that's a basic encapsulation of what's been happening in KP so far.
Thanks so much, Fasi. And let me also remind everyone who's joined us online that you can you can write down your questions in the YouTube chat box, and we'll come to your questions in a bit. Let me take on something that Umair mentioned, where he said that the efforts that the government has taken is to curtail the virus. So, I mean, my question is that, do we have clarity on the ultimate policy objective? What is government trying to achieve? Is it South Korea or New Zealand style elimination of virus from the country? Or is it just to flatten the curve and so that the hospitals are not overwhelmed and lives can be saved through medical attention? Or are we moving towards herd immunity, essentially, as the lockdowns ease and so on? And I think linked to this is the question around this debate on lives versus livelihood, where we've already seen a difference of opinion between the Prime Minister himself, who's focused on the devastating effect on economy and what it might mean for the deprived sections of the society, and the government in Sindh, perhaps, who's been more sort of emphasized on saving lives due to the health risk. So, Umair, if I can direct this towards you, and then anyone from the panel can add to it if they want.
Yeah, thanks, Adnan. I think I'll just say two things on this. The first is that today, the head of the National Disaster Management Authority, which is Pakistan's apex body that's currently coordinating the response to the coronavirus crisis, made a statement where he very explicitly said that we will have to bear with the virus till a vaccine is developed or till such time that cases start to decline. The term herd immunity is obviously not one that that is being used explicitly in most policy conversations. But I think the way that the conversation has been framed by the federal government as well as by the provincial government in Punjab, and again, I'm not saying that this is something that is unique to Pakistan. It's part of a larger policy conversation that we hear coming from both countries in other parts of the global south and academics and policymakers based elsewhere, which is that the lives versus livelihood trade-off is actually very real, and that there are a number of nascent data sets that show that the restrictions placed on economic activity pose real livelihood and mortality risks to obviously people, especially those who work within the informal sector, which constitute large parts of the economy for countries like Pakistan. So I think that particular framing has driven the conversation in Pakistan. I think that's one thing. The other thing is that there is a sort of a consistent refrain, so to speak, in the policy conversation that somehow Pakistan is not as badly affected by the virus as other countries have been. And this is largely based on obviously the mortality rate and the fatality count that Pakistan currently has. I think Rafi just also sort of pointed something to this effect, that this could very well be a function of the fact that we're under testing and that we're not following proper protocols as far as testing fatalities that are happening at this time period are concerned. But the larger point is that the argument that this is being used as an argument to both push through the larger sort of policy perspective that Pakistan cannot completely clamp down on economic activity, both because of a lack of state capacity to do so, and in that the state cannot coercively induce these behavioral shifts that are required for people to stay home so that they can flatten the curve, and because the livelihood risks that are ultimately that emerge from imposing these restrictions have their own sort of long-term negative consequences, and the consequences that the state cannot fill in the welfare requirements that would obviously pose that would be posed given the imposition of large-scale restrictions. So I think these two things collectively are where we can sort of glean what the Pakistan sort of government is currently aiming for as far as its overall vision for response is concerned.
Thanks, Umair. So another key aspect that has been observed in the government's response at both federal and provincial level has been this reinvigorated debate on the 18th Amendment and the distribution of power and resources between the center and the provinces. The newly appointed Information Minister of Pakistan said a few days ago that 18th Amendment is a hurdle in terms of evolving a national strategy on COVID-19. And the President yesterday has constituted the 10th National Finance Commission to review the distribution of resources between the center and the province. So if I can go to Rafi on this, Rafi, you've looked at federalism in Pakistan, extensively written on this topic as well. How do you see the state of federation in Pakistan and the effects of COVID-19 crisis on it?
Thank you, Adnan. First of all, I would like to flag that as per my understanding, there are two aspects to this debate about the 18th Amendment and the provincial capacities. It is the debate, there are many aspects to this debate, and the public side of the debate is that it is about weak provincial capacity and that probably the 18th Amendment has gone a bit too far and it has probably weakened the federation and similar sort of reservations. In my understanding, the truth is that it is not about these issues. It is really and actually about the issue of finance. It's a fiscal problem, and that fiscal problem is that the resources that are available to the federal government as a result of the 7th NFC award and the 7th NFC award and the 18th Amendment have left less space for the federal government to sort of play around with the budget. And within that, in particular, I think it's about the defense budget, from the share of the defense budget in the share of the federal government sort of expenditure. So it's really about that, but the issue is being extrapolated to other dimensions as well. So if we investigate these, I'll quickly talk about both aspects about, has the 18th Amendment actually gone too far in terms of the strength or weakening of the federation? And two, do the provinces have the capacity to implement the powers that have been devolved to them? So first, starting with the impact on the federation or the strength of federation, there is a lot of comparative politics literature available on the subject. The evidence is mixed if you look at it casually, but when one goes into the detail of that academic literature, it is very clear that federalism or decentralized federalism has been an effective tool in managing ethnic diversity and conflict in ethnically divided countries. The only evidence against decentralization or federalism is by scholars who have studied post-communist regimes, where the institution of federalism coexisted with an authoritarian form of government. So basically, these were the countries where federal model on ethnic diversity was imposed through a very brutal authoritarian form of government. In other words, federalism has been a very effective tool in managing diversity in democratic countries. Professor Bermeo from the University of Oxford has conducted a study where she has studied separatist violent movements in more than 30 to 40 countries across the world. And one of her biggest findings is that no violent separatist movement has ever succeeded in a federal democracy. So the idea that decentralized federalism is likely to weaken the federation, unfortunately, there is not much academic evidence to support it. The only evidence that is out there is in countries where federalism was imposed through a top-down authoritarian model. So that's the federation versus the provinces, and the centripetal versus the centrifugal forces. In terms of capacity, as I said, it is the issue. The real issue is actually about the fiscal side. I think if we look at the capacity of the provinces, I personally, working here with the government of Balochistan and some other policy documents for the federal government as well, I see this debate with the two angles. First is that have provinces demonstrated an increased prioritization of key social sectors after these were devolved to them after the 18th Amendment? It's not only a question of will and intent, but also do they have the capacity to sort of execute these powers? In terms of intent and policy recognition, I think there is sufficient evidence that nearly all provinces have increased allocation to healthcare and education after the 18th Amendment. The education budget in all provinces has hovered around 20% of the total budget, with some variations. Coming to the capacity, again, I do admit that there are constraints on provincial capacity, there are limitations, but I think in order to judge a province's capacity after the 18th Amendment, we will have to compare it with the situation before the 18th Amendment. And I do not think, I haven't come across evidence where one can confidently claim that the provinces or the federal government was doing a better job than the provinces are doing after the 18th Amendment. I think the provinces are doing a much better job despite all sort of limitations. So COVID in Balochistan's case, and Balochistan is probably the weakest in terms of capacity, but even Balochistan is doing a better job than the federal government. I would like to highlight too, GST on services, Sindh, Punjab, understandably, they increased revenue collection significantly after the GST on services was devolved to the provinces. But even Balochistan, since the past 3 years, Balochistan has been collecting GST on services itself, and the revenue collection has increased significantly compared to when the FBR was collecting the same sort of revenue. In terms of COVID, let's start with Taftan. The disaster that happened at Taftan, the managing Taftan was primarily a responsibility of the federal government. Unfortunately, they were nowhere, and Balochistan government didn't do a very good job either, but they did something. Despite their capacity constraints, despite limitations of resources, I think it was the Balochistan government that kind of saved the rest of Pakistan from an abrupt sort of explosion of this virus by quarantining around 6,000 to 7,000 people, transporting them to their respective provinces. I'm not saying that they did it perfectly, but they did something, and the federal government was nowhere to be seen. Then moving to many other sort of COVID-related measures, I personally don't think that the federal government is doing a better job than any of the provinces, let alone Balochistan or Sindh for that matter.
Okay, thanks, Rafi. And we can come back to some of these points during the question and answer session as well. Let's move to another key area. As we know, Pakistan has faced large amount of violent conflict over the last 20 years. And, as a result of extremism, terrorism, and other sort of social and political fault lines that exist in the country along sectarian, ethnic, class, and other sort of lines. And it's important to keep an eye on the conflict landscape as well, where we have some reports coming in from, let's say, the newly merged districts or Balochistan of some militant activity. We saw, in Afghanistan as well, a few days ago, the massive terrorist attack that happened. So if I can go to Fasi for this, Fasi has looked at the conflict landscape in the country for a long time. And Fasi, what's your assessment of the the conflict landscape in Pakistan and the effect of COVID-19 and some of the economic implications it may have on the conflict dynamics?
So in terms, it's interesting to see, for example, I do know the Ministry of Health, the Ministry of Human Rights recently set up a helpline for gender-based violence, but more than half the calls were actually for asking for financial help. We've seen nationally representative surveys by both Gallup and Ipsos, and the amount of which people have felt the economic pain within that is significantly overwhelming. There's another helpline also on GBV, and again, around 70% of the calls aren't for the purpose that they're meant. They're all asking for economic help. So it's a significant issue. People are feeling the pinch. I'd divide this into two categories. One is what would be the overall effect on, say, crime in the country? What would be the effect given how law enforcement will respond? So we've seen, this is not really that strong evidence, but from newspaper reports, post the period when the government lifted restrictions on construction, slightly opened up the public space, there's been an increase in mixed evidence of increased street crime in Karachi, which could be crimes of opportunity or they could be driven by economic need. The other big issue is that our security forces primed to deliver in terms of possibly raging infections within the police force or other security apparatus where they will have to operate on reduced numbers. So the UK has already been modeling at 20% people being at home. How do you work out on that? That's things that still needs to be worked out for Pakistan, given that our total caseload of infections is low and that they might suddenly increase come June, July. Again, in Sindh, for example, there's more than 100 policemen who've already got the coronavirus. There's a big nexus in Pakistan between drugs and terrorism, for example. And it's anticipated that this whole situation will probably help evolve some degree of how this operates, including much more than you having to go out to receive these things. You'll have more drop at home. There's a increased boom of online provision as well that's being anticipated. In terms of actual, how does it affect our conflict? So we've had incidents in Balochistan, we've got incidents in the tribal areas, but they do not seem to be either acts of terror based on the opportunity that the coronavirus pandemic has provided. They are falling in line with a trajectory that has been there for 6 to 9 months anyway. We've seen these uptake of incidents both in the tribal areas and it's been happening as well. And in Balochistan, of course, recently it was a response to 2 students who were killed. So in terms of like where this is going, the real issue is that there will be a period where we'll find that if the worst outcome projections come true, the greatest difficulty for Pakistan is that if we have rioting in the streets, when people will have to be denied care or ICUs are filled, and there's a perception of state failure, then there'll be a crisis. This public health crisis will become a crisis of public order. It'll become one of state legitimacy. And I think that's something that may be remote, but it should be something that needs to be factored in terms of the response to something like this.
Thanks, Fasi. And earlier on, you mentioned the helpline set up by the Ministry of Human Rights on gender-based violence and the drop in terms of the calls coming in for help on the gender-based violence. But we also see a contradictory trend where the number of incidents on gender-based violence being reported have actually shot up. So this is something that has happened elsewhere as well, where the number of calls coming in for help have reduced, but the incidents actually have increased. So if I can go to Nosheen for this, if Nosheen, you've worked on the gender-based violence, if you can please provide an assessment of what it means for gender relations in Pakistan and domestic violence and so on, as there are emerging reports and concerns in this regard.
Yes. Thank you for that question, Adnan. Much of my work with respect to gender-based violence actually intersects with issues of infrastructure and the built environment. I am an urban planner after all. So what I'd like to underscore in the context of this present crisis is that, and this I think pertains not only to countries like Pakistan and the global south, but also to what is happening in the global north also, because gender-based violence has reports are actually coming out similarly for cities across the global north as well. And I think that the issue of self-isolation, quarantine under the present circumstances brings up the issue of confinement in very important ways, that when people are confined, especially in terms of certain types of class backgrounds or in terms of certain cultural factors, how these might intersect to exacerbate domestic violence situations, for instance. So if I might use, for example, the case of large metropolises or urban centers like Karachi, although gender violence, I mean, I would like to sort of make it very clear that gender violence is something that cuts across classes and ethnicities and so forth. But that perhaps when we're looking at communities that are marginalized or that are income poor and are sort of stuck in situations of trying to manage themselves in a built environment where confinement is particularly exacerbated by very, very small rooms or very small spaces, where the possibility to separate yourself in in larger rooms or in a garden or in a veranda, or just find a place of isolation where one is on one's own, these possibilities become much narrower. These possibilities or these opportunities simply don't exist. So people are thrust together in situations where being inside actually becomes more dangerous than being able to come outside. So this question of freedom for women especially, and even I think for children who are also perhaps on the receiving end of violence. I mean, we often forget that the question of domestic violence cuts across both women and children of both genders, young boys and young girls as well. That issues of confinement under the present conditions of quarantine and isolation might very well heighten the issue of domestic violence, but not pertaining only to women, but also perhaps to children. And I think that going forward, what are the kinds of sort of dynamics that we are going to be seeing coming out of this emergent situation in terms of the psychological violence that might be meted out on those who are the receiving end of this particular form of violence under these particular conditions of confinement. This is something that perhaps needs to be addressed or looked at or researched going forward, because these are not these are complex issues, and these issues also dovetail with questions of the built environment, with urban planning issues, and these are highly gendered issues as well. So how we plan our cities and how we address issues of of housing and care and maintenance and all of this ultimately also becomes a very important part of what we are possibly witnessing right now in terms of reports of gender violence going up in specific urban centers or in specific neighborhoods and so on and so forth.
Thanks, Nosheen, for this. We can now go to some of the questions that have been posted by the viewers. And one of them is about the particular cultural characteristics that we have in Pakistan and in South Asia in general, and how do they affect the response to COVID-19 kind of dynamics. I mean, some of the factors Nosheen mentioned in terms of the the population density and so on, but of course there are others as well. So if I can initially go to Rafi for a reply, but please feel free to add. Any panelist can add to it in terms of the peculiar cultural, social, and other characteristics that makes, and there is evidence from the Spanish flu of 1918 that South Asia subcontinent in particular was badly affected by that pandemic. Rafi?
Adnan, your voice broke down. I couldn't hear your question. Can you please repeat?
Yeah, so the question is about the cultural and social characteristics that we have in Pakistan and South Asia in general, which may make it more difficult to deal with COVID-19.
Okay. Yes, I think certain sort of cultural norms and traditions, our cultural, our style of living, they are a significant hurdle in the containment of the virus. In particularly, I would like to identify joint family system. Since my family personally went through this experience, so I would just like to highlight a few important points. We, for example, we are 29 people in one family. We live in the same building, in the same house. And the problem with this kind of family systems in a pandemic situation is that if one person in the family gets it, if one person in the family is infected, it is almost always sure that the entire family will be infected because usually in such joint families, there is no concept of an individual room for each individual in the family. It's usually the kids sharing one single room, like 3 to 5 kids sharing one single room, and then sort of we all eat together, we dine together, we sit together, we drink together. So I think that becomes a challenge. Both the spread of the virus, it easily gets spread to many other people, and B, because this virus is stealthier in nature, the incubation period takes 5 or 6 days when before the symptoms appear. During that period, it is already in our case it had already been spread to the most of the family members. And when you realize that the family members are infected with the virus, in a joint family system, it is almost impossible to arrange quarantine facilities. How do you quarantine 30 people? It's not possible. So you need spare accommodation facilities with attached toilet facilities, and this becomes a huge problem. In our case, we didn't have these facilities, and we come from a relatively sort of middle class background here in the context of Quetta. But imagine this for people other than the middle class, the lower classes. They also have similar family sizes, and in case they get infected, it is almost impossible for them to arrange accommodation space. It is almost impossible for them to arrange to implement isolation and quarantine, the basic protocols of COVID-19. So, and similarly, the communitarian culture overall, where you sit together, you dine together, you meet people. So another interesting thing that I observed in our context, in our case is, I have been sort of investigating the origin of the spread of this virus and how it came to our family. It turned out it was a social occasion. It was Fatiha. In both cases, there were two people who we think were the source of sort of entry of this virus into our family. One was my mother. She had, her mother had died. She had gone to her mother's funeral, Fatiha and everything. She stayed there for a week. That was where you have huge congregation, people come and go. And the other case was where one of my sister-in-laws had gone to inquire after the health of her mother, who was severely ill and sick. And she stayed with her mother for like a week or 10 days. And her mother lives along the Pakistan-Afghanistan border, Chaman, in Chaman town. So these were both social occasions which were responsible for the spread of this virus. And then when it came to the family, by the time we realized, nearly the entire family had been infected. And those who were not infected, we did manage eventually some sort of quarantine and isolation facilities for them. But I think 90% people do not have that luxury and privilege to arrange those facilities in a setting like this.
Thanks, Rafi, and also for sharing the personal experience and what your family went through. We do wish all of your family members speedy recovery. So given all these dynamics, if I can go to Fasi for another question that has been posted with regards to the awareness and the communication from the state. How would you assess, in such a crisis situation, the messaging that has come from the federal government and the provincial government and the rest of the stakeholders? What's your assessment in terms of the effectiveness of raising awareness on COVID-19 in Pakistan?
I think that Pakistan was also subject to something that happened internationally, is that in any public health crisis, one of the problems is that people tend to believe the first thing that they hear. And this is a fairly established principle that's been observed around the world in terms of public behavior. And because this was not well understood in the beginning, there was a lot of messaging that wasn't very concrete that obviously went down. But I think what was mostly very clear in Pakistan's case is that once the provinces got on board with the program, realized the scale of what was happening, their messaging, by and large, was fairly straightforward, fairly good. I think Sindh is a great example of that. KP is an example of that. I think Punjab was problematic in the beginning, but overall, it has also done very well in this respect. I think our real problem is the mixed messaging that kept coming out from the federal government, who at one point saw health and the economy as a binary. And even though there was a lockdown that was mandated, came from the federal government, there was some talking it down that kept happening. So even right before an extension of the lockdown, it seemed, if we were just to follow what the federal government was saying, it seemed like a case was being made to lift it. But then there was an announcement of an extension for a week, 10 days. And so I think this is where we've been relatively weak. The other, on just a technical issue, is that a lot of the messaging that's gone out is very clinical also. So when we look at instruments like television, radio, and all that, it's about hand washing, it's about social distancing, that's fine. But after a while, people tend to zone that out. So we've also seen Pakistan has a really good innovation, is that if you call someone, COVID messages are read out to you. But when people have been polled, they haven't heard those in full, or they ignore them entirely, around 50% or maybe even more. And that's partly because of the static nature of the messaging. The brain tends to head you by zoning those out. So I think more needs to be done in terms of showing it why people need to care. You have to frame it in terms of that maybe you might survive it, but you'll get somebody infected who you care about, because those levers are very important in public communications. And right now, the other thing is that, ironically, most of it has been done primarily by earned media, which is press conferences. The problem with press conferences is there's a lot of political polarization going across. So sometimes the messaging gets caught out by what's more newsworthy, which is what is the relationship of antagonism between federal and the province, for example. The other is that a lot of it's done digitally. There are problems of access that go that way. So putting more money behind things like television, where we know at least everyone in Pakistan watches 2 hours of it every day, where there's no access to digital, 90% of the people receive the signals, radio. And the polling also suggests, I think what's really interesting in the polling in Pakistan is that people are by and large happy with the response. of how the governments handled it, and this includes the provincial and the federal. But a very high percentage of the people also believe the threat is exaggerated. And they're also reporting a high number of people still going to communal prayer at mosques. They're not following those advices. So what it shows is that you've got people holding contradictory opinions, which means they don't have a very firm opinion on this crisis as of now. And that is still an area that I think Pakistan can do more on, because it's important to, if we're going to lift the lockdown, if we can't sustain the economic damage, then the most important lever will be getting people to take precautions on their own, and they have to really believe and imbibe themselves with that.
Sure. So, Nosheen, if you would like to add something, please do go ahead. But let me pose two very short questions to you as well. First is around the communal tensions. Initially we saw a bit of antagonism against the Shia pilgrims coming back to Pakistan. How has that situation unfolded? And second, there is a perception that perhaps mortality rate in Pakistan is lower than others. What could possibly, what's your assessment of that as well, please?
Okay, thank you, Adnan. I just I think that the comments that Zaki just made were all extremely important in terms of messages and communication, etc. But one of the things that I find quite remarkable is that we haven't talked about in the broader terrain of governance dynamics. This conversation has remained quite restricted to the center provincial question. Where is local government in all of this, right? So it's almost as if the governance dynamic when it comes to the COVID-19 crisis stops at the province and somehow nothing cascades downwards. And I speak from the vantage point of urban Sindh, and I'm using Karachi as a paradigmatic case, which is Pakistan's largest metropolis. According to the 2017 census, 16 million, but in actual fact, probably much more than that, 20 million, given the manner in which the census was conducted. Sort of what I'm seeing happening, and I'm in lockdown myself, I'm under self-isolation, so I don't have data at my fingertips, nor do I have the capacity to empirically observe what is happening, for instance, in the wide variety of income poor settlements or the informal settlements in which over 60% of the city's population resides. But based on my informants, based on the people that I have built relationships with in various communities across Karachi, I've been hearing all kinds of things, right? So the sort of the urban sensorium through which academics like me get access to certain kinds of data is becoming quite important now. And part of what's coming through this sensorium are stories about how, well, people simply don't have access to government at the present moment. So who can access a deputy commissioner? Who can access a district commissioner, right? It's that the only persons that they could possibly access is the union councillors. And where are the union councillors? So when it comes to issues of communication, when it comes to issues of relief measures, when it comes to issues of accessibility, of gaining access to the right kind of information, or just being abreast of what is happening in a time of emergency or crisis. And people who live, in these neighborhoods actually are always living in a permanent state of crisis, right? Whether it has to do with degraded infrastructures or water scarcity or load shedding or the crisis of tenure and the crisis of affordability. Informality is a day-to-day condition of both of living and sustenance and survival and all of that. So then COVID-19 presents itself, it sort of, attaches itself as a form of a disaster that is linked with many, many other crises that keep on building up, to sort of like a massive tsunami. So for people on ground, what I'm hearing is, from places like Orangi Town and parts of Machar Colony and others, that, we would like to know where our union councillor representatives are. And I think that this is an incredibly urgent issue that people need to start talking about, policy makers need to address, in terms of, well, okay, so the center provincial dynamic is a very important one. The 18th Amendment is a very important issue. But what about local governance systems in places like urban Sindh? I can't speak for Punjab. I can't speak entirely for Balochistan either, because, issues of welfare measures, reaching out to to populations that have never actually even been counted or cannot be counted, because the question of opacity or the challenge of opacity is a huge one. The state can see, but there are so many things that the state cannot see or is not willing to see. But you have a dynamic, you have a situation in which local governance systems do or can address these kinds of issues. And then added to that are complications of data, right? I mean, what kind of data do governments have available at their fingertips? I know in Sindh, the data issue is an absolutely critical issue. There isn't enough data available. I mean, you have the healthcare department that is still generating healthcare data to figure out virus hotspots in Karachi based on information that was made available to them when, under the General Pervez Musharraf era, Karachi was declared into one district. And then after 2008, it was turned into 6 districts. Whereas the healthcare department in Sindh is working off of documents and data and information that is old. So when it gives DCs information on viral hotspots in certain UCs, the DC is trying to figure out what these UCs are, and suddenly, they realize that, wait a minute, this is old data. We don't have enough information available. We don't even have enough data at the ward level. So I think that in a moment of disaster, in a moment of emergency or crisis, the question of data becomes an incredibly important one. Is it up to date? How is this data being generated? How is it being mapped, right? All of this. So I think, again, this comes down to the level of the molecular. And I think that the molecular is not a part of our conversation right now. So if we keep on insisting that the buck stops at the level of the province, when it comes to handling these, these crises, I think that we're missing out on a much bigger picture, which also needs to be addressed. So, I'll just stop there. Although I know I haven't entirely addressed those other 2 questions that you also raised, but I don't want to take up too much time.
Sure. No, I hope our moderator will be able to paste responses to those 2 questions in the chat. Let me just take one final question and pose it to Umair about the civil-military relations. As we know, Pakistan has had a troubled history of civil-military relations. However, at this critical juncture, at this point in time, Umair, how do you see civil-military relationship in dealing with COVID-19 in Pakistan?
Yeah, thanks for that. I think this is, I think in times of crisis, we've actually usually seen fairly extensive degrees of institutional coordination between civilian actors and military actors in Pakistan's history, whether it was in earthquake relief, where we actually were under a military regime, or whether it was the flood response in 2010, or in terms of sort of resettling internally displaced people during the counterinsurgency campaigns from the last decade. I think one of the things that is quite apparent is that under the current dispensation, which sort of borders on what we would classify as a hybrid regime, the military has significant leeway in terms of deciding sort of decision making on particular domains, and not just in sort of historically in domains that it has historically had a say over, such as internal security or foreign policy and obviously national strategy, but also in things like the disbursement of fiscal resources, on issues of coordination and communication. All of those things, those are also where the military has certainly enhanced its footprint as far as the current government is concerned. I think a couple of things are quite indicative that the government is more than willing to, the civilian government is more than willing to let the military play that part. There have been occasional sort of bouts of tension between obviously different actors, but by and large, the military has played a significant role in coordinating the response at the provincial level. I'll give you just one example from Punjab. So the committee that was formed to advise the public health department, the primary and secondary healthcare department, on a healthcare-based response to corona, also included representation from obviously the senior most military officer currently within the province. That's the commander of the 4 Corps based out of Lahore. The military has also taken an active interest in ensuring that food supply and so food supply chains are retained and obviously don't suffer from corona related consequences. They're currently sort of coordinating the effort for wheat procurement in the province of Punjab, and that too has come out quite clearly. So I think these are again sort of very clear-cut examples of institutional coordination that we see. However, these have long-term consequences for the structure of decision making in the country, and most importantly, to go back to something that Rafi had flagged earlier, these have consequences for the fiscal architecture of the country as well. As the military is a federally government funded body, it is a central government institution. If there is to be any revision in terms of the amount of resources available to the center, that will be something that obviously the military has a keen interest and stake in. So I think those are some of the issues. But as far as sort of institutional coordination is concerned, I think what we currently see is largely sort of non-conflictual and sort of fairly coherent in terms of what's actually happening. By and large, this obviously would change depending on the particular provincial context that you're looking at.
Thanks so much, Umair, for very pertinent points. And I'm afraid we are running out of time. So I'd just like to conclude by saying that COVID-19 is a global challenge. It's a global pandemic. And it can either force people, incentivize people to come together, coordinate with each other, help each other in finding the common challenge, or it can exasperate the existing fault lines among different communities and stakeholders and so on. And we hope that it's the former rather than the latter. And that is where USIP also sees its role in terms of facilitating different stakeholders to come together and evolve a common strategy in fighting this battle. I would like to thank all of you for your time and for your valid comments. I would like to thank the viewers for joining us today and the USIP staff members who put all of this together. Let's hope for the best. Let's hope that everyone stays safe and healthy. And please do tune in to our YouTube channel and other pages. We'll be doing this more regularly, not just on Pakistan, but also analyzing other contexts around the world. Thank you very much, and hope to see you again soon.
Thank you, Adnan.